my stuff to clean with the chlorhexidine, then another layer with alcohol. For our beautiful model today, Reem, so she suffered from losing volume little bit in the middle cheeks, and little bit tear trough. So this is, I start from the corner. You see these lines where we start the tear trough. This is the ligament. Here we start losing the volume. We will inject the 1200, the high molecular, in entry point as a fanning technique. We will go like this. I will try to reach the nasolabial fold. And sometimes I also go back. For the same patient, I use the cannula and fanning technique following these lines and these lines. So here what I try to share with you, my friends, my technique. This is what I use it every day in the clinic. I do like this. I go until I reach the nasolabial fold, and I go to the corner of the mouth and down, and I go also, I put back in the zygoma bone. For the superficial one, I will show you maybe in the other side later how we can inject, or which point we injected. I'm gonna use here 25 gauge cannula, 40 the length. Sometimes I use 50. So in one cannula I can reach everything, especially if we have, long faces. So this is the entry point. So usually patient, she doesn't feel pain. I told her she will feel discomfort moving of the cannula. I start injecting. The other hand, I use the other finger. I feel where is the end of the cannula, where is my product, as how we inject the fillers also. You can see the tip of the cannula. Almost I am here at the end, the tip of the cannula, the beginning of the nasolabial fold. I inject and withdraw back. You will feel some resistance in your hand. So we try to manipulate the cannula. It will be more easy for the patient. We go fanning technique. And that's it. We inject 1 ml in this side from the high molecular weight, 1200 Sunekos. So now we will do the Sunekos 200. As I told you in the beginning, I try to share how my experience, or how my style, or how my way, you can, if you want to say, an injection. So under eyes, I try to put the minimum amount because I don't want to bruise the patient. This area is very sensitive and easy bruising. So usually I try to, you will see now, I will try to do some superficial, very, very superficial injection for the small lines and fine lines here. And I sometimes also I do deep, especially if they have a groove or tear trough. under the eyes. Now I will try to share both way of injection. I am on the bone. I put 0.1. I go back. I put also at this point 0.1. I am on the bone. Okay. Now I will show you. Here I use the long needle. So this is 0.4. So we can, or 4 ml, sorry. So we can reach to the bone. But when I will go now to do superficial, I ask the patient to look up. Yes. And I go very superficial in the lines. I can see my needles. And I start to inject as a bolus. Now we go to the other part of the face. I keep 1 centimeter to 2 centimeter between each injection of 0.1 almost. So nasolabial also. Here a little bit irritated for the patient. I will just clean and I will show you what happened here. But this is not the result because this product, it's working on the skin quality. So for this, we always advise that we need to wait until this product, because now what you will see, this is the hyaluronic acid, the water retention of a hyaluronic acid. So, but as skin quality, we need time. So to give chance for this product to start working on the amino acid to stimulate, or the fibroblast start working and producing the collagen. So I massage a little bit where I put the product. Here I try to push it inside the tear trough. Gently massage. So if I have another patient, for example, with very good volume here and saggy skin here, I will do the fanning technique in the opposite way. So I try to, because as you know, this is the ligament here. So anything we injected back, it will help in lifting also. So, and usually this kind of patient, we feel a lot of volume here and there is no fat or no volume here because, the aging process will pull down everything from the fat tissue, everything down. So I try to go fanning technique in the opposite, but I put little bit in the middle cheeks. Why? Because this is what we can say, the tips that let the patient, all the women, they love this area to be, a little bit plumpy. So they feel a freshness when we inject little bit here because the water retention of a hyaluronic acid. So we finish this side and now we will start the other side. We are lucky, no bruising, that's good.